All right. Your question has been answered. Okay, thank you very much to all esteemed speakers for the wonderful insight and sharing. All right, I think it's already 11:22. We have exceeded the time. On behalf of the QAM KHM for the International Conference 2022, I would like to thank all the speakers for the great sharing. Inshallah, so I hand the session back to the MC. Thank you and wassalam.
Thank you, all the speakers.
Thank you very much, moderators, and also all the speakers for the excellent presentations and also quite a fruitful discussion over the Q&A session just now. As mentioned, we actually already dragged a little bit. So since this is an online platform, we will give you a break to just while just go to the kitchen, get a cup of coffee, come back to the screen, okay? Because we will be continuing with our next session, which will be our keynote speech delivered by our very own DG of Health, Tan Sri Datuk Sri Dr. Nur Hisham bin Abdullah. He will be delivering a keynote speech entitled "The Eagle Eye View: Value-Based Leadership at the Frontline of Management." So just a little bit on his background, as I guess everybody have already known him. Tan Sri Datuk Sri Dr. Nur Hisham Abdullah, he's an endocrine surgeon who also served as the Director General of Health since March 2013. He's also the current president of the Malaysia Medical Council, MMC, and also the board of directors of the Drug for Neglected Disease Initiative. In his role, he has been prominent in leading Malaysians' response to the COVID-19 pandemic. After obtaining his fellowship training in various institutes in Australia as an endocrine surgeon, he also served as a head and senior consultant of breast and endocrine surgery at Putrajaya Hospital and still holding that position till today. In terms of awards and excellence, nothing to be doubted of. Dr. Nur Hisham has received the Excellent Service Awards in 2000, Hospital KL and Excellent Service Award, Federal Territories Kuala Lumpur and Putrajaya Health Department for the recognition of his service in his medical career. So for this keynote speech, we will be listening to what he has to say in a recorded video, inshallah. Let's all listen to him.
Chairman of Consortium, Hospital University Awang, Malaysia. Honorable Professor Dato Dr. Muhammad Saufi Awang, Hospital Director, Sultan Ahmad Shah Medical Center, International Islamic University Malaysia, come advisor, the 4th Guam National Conference. Honorable Professor Dr. Zamzuri Zakaria, Director, Sultan Ahmad Shah Medical Center, International Islamic University Malaysia, come Chairman, the 4th Guam National Conference. All hospital directors, seniors officials from the Ministry of Higher Education and International Islamic University Malaysia, honorable guests and ladies and gentlemen. First and foremost, I would like to draw your attention to the eagle eye view of value-based leadership at the frontline management. I would like to quote Alexander the Great, and he said, and I quote, "An army of sheep led by a lion is better than an army of lions led by the sheep." This is the crux of leadership of today and the future. Being a leader, you must be a good listener, empathy and understand the situation. You must have self-reflection and humility. More important, to be honest and transparent. And our intention, sincere intention is important. That is actually our nawaitu. Be creative and innovative. Being a leader, you need to come up with ideas. And these ideas will be the leadership that you provide that will change the way we manage things differently. And you must have the foresight by learning from the past, present, and the realities of the future, what we anticipate, and how do we react to the things that comes in our way in future. And being a leader, you must be engaging, persuasive, rather than using your positional authority. And the most important is engagement, whereby you explain issues and challenges, and more importantly, to manage the expectation. And this will give the trust, the public trust, and the trust of the people that you lead to you, and so that you have a strong support. More importantly is the learn to operate in challenging, unpredictable circumstances, especially when present with the healthcare scenario and issues. So we have the basic skills, but these skills you must apply these skills to the various circumstances and scenario. So these are some of the pillars of the leadership that we need to embrace before we embark to lead any organization. Next slide. The first rule of communication is to listen. And this is a very important Chinese character, that is listen. And I learned this character during an advanced management program in Oxford. And this is a character whereby the word listen comprises with the various characters and put together. For example, listen to hear, that is very important. To think and to be present and to see and to focus. But more importantly, if you can see, the last is a character of a heart. To listen with your heart. And this is to understand the subject matter, to understand the issues and challenges before even you make any decision. So the first rule of management, the first rule of leadership is to listen. Next. Now, the servant leadership is a leadership style and philosophy whereby an individual interacts with others either in a management or fellow employee capacity to achieve authority rather than power. So there's two kinds of leadership, the traditional leaders and the servant leaders. Now, we in Ministry of Health, we embrace servant leadership. After all, we are all civil servants here. We see leadership as an opportunity to serve others. And this is where I think share power and control to drive the engagement, measure success through growth and development, and we listen. And more importantly is to understand it's not about us, but about what we can do to make a big difference. And does the style of leadership reflects a selfless attitude? Are you putting the needs of others first, or are you leveraging your position and resources for your own gain? So there's a balance between a servant leadership and a traditional leadership. Now, traditional leadership is very authoritative, uses power and control to drive performance. But if sometimes we need this kind of leadership, but it is actually depending on how you apply this form of leadership. And you measure success through output. And in terms of leaders, traditional leaders, they speak. They are not listening. They speak. They believe. If they are doing things right, that's good for the country. But if they are doing things wrong, then it's bad for the country. It's about the belief in themselves. So I think this is the two leadership style that we have. But in today's day and age, servant leadership is certainly the way forward. And you can read this servant leadership written by Greenfield in various publications. Next. So a good leader must be a good servant, and that's what I believe. And all of us civil servants, we have contributed, and with all the skills that we have, and more importantly, the skills must be applied to situation and circumstances. Now we talk about the world's COVID-19 situation as of 18th of March 2022, and we see some of the data. Last 24 hours, we see about 2.1 million people have been infected globally within 24 hours. And to date, overall, 462.7 million people have been infected with COVID-19, of which fatality rate is fatality toll is 6.1 million people have died from this infection. So COVID-19 cumulative case in Malaysia is more than 100 in 10,000 in 100,000 population. Next slide. Now, if we were to look into the COVID-19 trend by the 6 WHO region, Europe, America, Southeast Asia, we are in the Western Pacific, and you have Eastern Mediterranean, Africa. Now, you look into this graph, the Europe and America, they have a spike of cases and exponential surge recently. But after the surge of Omicron, you can see cases are coming down. But lately, we continue to see some form of surge in the UK, Europe, as well as in US. In Asia, for example, in the Western Pacific region, there's an increase of cases weekly, 29%, as compared to 12 and 2% for other region. So I think while UK, Europe, as well as America is seeing a downward trend, and now they're seeing a slightly increase in cases, but we are still seeing some exponential surge. But over the last 2 weeks, we are seeing in Malaysia, for example, a plateauing of the cases, the daily cases. Next. Now, this is the latest case trend. COVID-19 infection shows increase since December 2021. And in Malaysia, we see there's actually a spike of cases, and also Thailand, we are also seeing the same trend. In South Korea, 2 days ago, they reported 600,000 cases within 24 hours. That may be because they just had their general election, and maybe that contributed to the increase in cases. But the similar trends is also seen in ASEAN countries. Now we are seeing the third wave with the 2 spike. You can see the earlier spike in July and August, namely due to the Delta variant. But now we are seeing the Omicron spike, which we have seen some of the high transmissibility in Omicron, but the virulence is certainly less compared to Delta variant. Next. Now, our Ministry of Health, our strategic plan is to flatten the COVID-19 curve. And that has always been our aim from day one. And we have 6 pillars in our management and the strategic plan. Number 1 is stop the chain of transmission. How do we break the chain of transmission? So we applied FTTIS, and now it's automated for efficient pandemic management and to reduce the chain of transmission. Second pillar is to reduce the morbidity and mortality, and this we will have to enhance our hospital capacity and capabilities in managing a COVID patient, especially the vulnerable population. Now we do have antiviral that is able to stop the deterioration and progression of the disease to category 4 and 5, i.e. We are using Paxlovid as well as Molnupiravir. In the earlier phase, during the stage 1, we are seeing we have used some of the antiviral for HIV, like lopinavir, ritonavir, also anti-malaria drug, hydrochloroquine, and ivermectin. But today we have shown that the research have shown in the solidarity trial, the anti-HIV drugs and as well as the anti-malaria drug is not effective at all. Likewise, the antiparasitic ivermectin is not effective. That's one of our success in the ITAC trial, showing a randomized control trial, and this paper has been published in JAMA, which is one of the top peer-reviewed journal in the world, and has attracted global attention to this paper. And third is strengthening the diagnostic surveillance. Initially, when we started, we were only able to do about 1,000 tests a day from 23 labs. But now, with the RT-PCR capacity and capabilities, we are actually improved, and we are using the RTK antigen by the professional and RTK antigen self-testing. Our capacity has actually increased more than 200,000 a day. So we have the capacity now. And obviously, when we started, we have very limited tools, but now we have optimized the immunization coverage, vaccines available, and our vaccine coverage is very impressive. And at the moment, I think this is one important tool apart from public health measures, apart from testing, vaccination. Last but not least, also the treatment. And the fifth pillar is improving awareness and cultivating the new norm. We cannot win this war if the public is not on our side. We need to educate the public to basically to understand. This is where the engagement, explaining of the issues and challenges, and manage the public expectation. And if public can follow, what we advise them, for example, during the first wave, we do not have vaccine. Our testing capacity were very limited, as well as we do not have a good antiviral. But just the compliance, the public health and social measures, we are able to bring down the cases to zero on the July 14, 15, and 16. It shows that compliance is very important. So we continue to use the public health and social measures. Last but not least is strengthening the mental health and psychosocial support. We understand the COVID-19 has actually prolonged for more than 2 years. That has caused mental and physical fatigue to our healthcare workers as well as the public. And to fight this war, it's not over yet. We are not out of the woods yet, but we need to work together as a team. And although we have these 6 pillars in place, but this is not the responsibility of the Ministry of Health only. We must work together, a whole government and whole society approach, multi-sectoral involvement, public and private partnership. We must look into other means like legislative, ordinance, national policy, SOP, and enforcement. We must support each other in terms of mobilizing the human resource, logistic, and equipment issues. How can we optimize the resources that we have? And funding from the MOF for us to upgrade some of our wards, our facilities, and etc. And over the last 2 years, we have seen utilization, healthcare, health transformation in terms of utilizing electronic means. There is automation in MySejahtera, for example, in SIMCA, in e-COVID, in virtual consultation, and etc. So I think this has actually transformed the way we do things differently because we have a reason now to adopt and adopt to this electronic transformation, digital transformation, and move forward. And more importantly is now we have all the tools in place, monitor and evaluation of the situation before we can balance the rightly between health and economy, and also between life and livelihood. We are challenged with 3 main crises: the health crisis, the economic crisis, and the political crisis. And we need to handle this well for us to fight against COVID-19 in our country. Next. Now, if you were to look into this COVID-19 chronology and distribution in Malaysia, we have 3 waves. And the first wave mainly the impact from the tourism industry, those coming from China, the Wuhan, they brought in the infection. And the first wave, we have 22 patients, no fatality at that point of time. And we managed to contain the infection in our country. The first case was reported in Johor Bahru, whereby a tour group, 12 people in a tour group, and the grandfather and the father were infected and were detained admitted to Singapore, but the other group came over to Johor Bahru. So once the someone in the tour group have been infected, naturally the infection, incubation period and infection were detected in 3 of them in Johor Bahru. So, but we managed to contain the infection in our country. And then we have 11 days, no cases been documented. Then comes the second wave, which is the public gathering. That is the cluster Sri Petaling, whereby we were told that 15,000 people from all over the world gathered in the Sri Petaling Mosque. This is the public cluster. But more importantly, before because of the IHR International Health Regulation, from Brunei, one of our colleagues from Brunei informed us that one of the participants has been infected. So we went to the mosque, but too late. Most of them has actually returned back to their own respective states as well as country. And we were worried then because we know just within a matter of time, within 2 or 3 weeks, there will be spike of cases from Perlis until Tawau and Sabah. So we need to take drastic action. That's where I think we started on the 18th of March. We decided to have a lockdown. Lockdown should not be long term. Lockdown should be short term to buy time for us to prepare ourselves to handle the outbreak of this pandemic COVID-19. Then we managed to control, and as I said, in July, we managed to bring down the cases right down to zero. This shows that the compliance of the patients and the public are very good to the public health and the social measures. And we have a daily engagement with the public to calm the public, to address the issues and challenges about COVID-19. But the third wave came about following the PRN Sabah. And following the PRN Sabah, you can see cases beginning to spike. And again, we tried our best to use public health measures, but it was not successful because again, it depends on the compliance of the public. And then there was a spike in July and August 2021, and this is where it was due to the Omicron spike. This is due to the Delta spike with a high fatality rate, and we managed to step up in terms of our vaccination coverage. Our vaccination started on the 24th of February 2021, and we scale up in terms of the 3 phases. Phase 1 mainly for the healthcare workers and the frontliners. Phase 2 for the elderly and those vulnerable population, and phase 3 to the public. And you can see that we managed to scale up the vaccination in September and October in the Klang Valley, and we managed to bring down the cases. And then in December, we are seeing another a new variant, that is Omicron variant, and eventually the Omicron cases continue to spike. As the highest been detected is about 33,000. During August, 26 August, our highest daily cases about 24,600 cases, but with a high fatality rate in 2021 in August, as compared to when we have 33,000, there was actually less fatality as compared to 2021. Next. Now, we have COVID-19, e-COVID, and we share the latest information daily. And 2 days ago, you can see that 26,285 cases has been documented. The total local cases are about 3.89 million. And the imported cases, we still able to control our border, and the imported cases, about 719 were detected. And most of the cases, the active cases to date, about 296,000 active cases. And most of the active cases, which is positive, managed at home. That is 96.6%. And only 0.7% managed in our PKRC, and 2.6% needed hospital admission, and managed in ICU only 0.01%. Likewise, needing ICU or ventilation in ICU is only 0.1%. Our recovery rate now, as well as the numbers, are high. More than the 29,000 have recovered, and now death, we try to address the BID. Even before pandemic COVID-19, every day we document about 30 to 40 BIDs. Likewise, now if you see the BIDs that brought into the hospital is about 86 of cases. Again, almost 98% of the adult population has been vaccinated. That's the reason why there's an increase in the BID, for example, that been documented. Again, they do not know that they have been infected. So next is the brought-in death is about 35 cases have been documented yesterday. Next. Now, the value of R naught, that is a reproductive number. The best is that if we can bring down the R naught to 0.5, which means if you have 100 cases, then one cycle of incubation period, we can the cases are less by half. That means 50 cases a day, and then subsequently 25 and 12 and etc. So that's if our R naught is 0.9. We started with this Omicron of R naught is about 3. Then we managed to control, and now at the peak of Delta, it was actually 2.6. And now I think with the public health measures and the vaccination and breaking the chain of infection, identifying the patient early using the national strategic testing, we managed to bring down the R naught to 1.0, and then now it's about 0.96. So we hope that we can continue to comply and to use all the tools that we have to bring down the R naught to less than 1, preferably if we can achieve a 0.5, that would be the ideal. Next. This is our SEIR model in terms of prediction. If based on our daily cases, the column that you see, if our R naught is 1.6, earlier, you can see early of the year, our cases are following the trajectory of 1.6, which means that we are anticipating about 50 to 70,000 cases a day if the R naught is 1.6. But now we managed to bring the R naught down to 0.95. And if it's 1.2, you can see that it's follow the beach trajectory. And we hope that we have passed the peak, and the cases have been plateauing for the last 2 weeks, and we hope that the cases will continue to come down, and hopefully we can control the cases and move on before we open our borders. Next. This is the widespread COVID-19 vaccination coverage has impacted the rate of the hospital and ICU admission. If you look into the dark line, the black line, this is the number of primary vaccination being given. The dotted line is the booster dose. And the cases, for example, the ICU beds, the red line is coming down. When our primary vaccination rate goes up, the cases admission to ICU decreases. And likewise, the admission to the ward, the blue line, as well as the utilization of PKRC beds is coming down. But lately with Omicron, we can see there's some an increase admission as well as utilization of ICU and PKRC beds. So this is, but it's still within control. Next. But if you were to look into it, the admission that we have in the hospital, category 1 and 2 is about 60%. Category 3, 4, and 5, 40%, which means now we are admitting the category 1 and 2, which is the vulnerable population. One is because we are taking prophylactic measures. Second is that the patients are coming to our hospital for other procedures, for other reasons, but detected positive, but they are in category 1 and 2. So the admission is not because of the severity, but because it's an incidental finding that they are about 60%, or prophylactic because to prevent deterioration and etc. So we hope that although the cases still are stabilizing, but we hope that we see less admission. 99.9%, 99% 99.5% cases daily are in category 1 and 2. 0.5% to about 1% is category 3, 4, and 5. Next. Now, looking into the COVID-19 death rate by the epidemiology week, this is the case fatality rate. During the Omicron peak, we are seeing about the fatality rate is about 2.06%. But until 5th of March 2022, the average COVID-19 case fatality rate in Malaysia is 0.92, But the good thing is that if you were to look closely, the fertility rate now has actually came down to 0.15, and now is 0.9. That is 15. I think that is some remarkable improvement in terms of how we manage from 0.92 to 0.15. So that is why I think we are seeing less cases, less death as compared during the Delta surge, whereby the case fatality rate is about 2.06%. Next. The death rate per 100,000 population according to the vaccination status. So the daily cases you can see is increasing, but those unvaccinated is about 40 per 100,000 population. The numbers are unvaccinated being detected. And those vaccinated, fully vaccinated, primary dose, that means 2 doses, is less than 5 or 6 per 100,000. But those who have been given the booster is very much lower than that. Next. So the moral of story is that we need to get the booster dose, because we know that after some period of time, 3 months for Sinovac vaccine, 6 months for Pfizer and AstraZeneca, there's a waning of antibodies. And this is a decoupling effect that's been seen. The decoupling effect means that although we see a spike of the Delta peak in August 2021, the fertility rate is about 2.06, so it's very high. But now, although the Omicron peak is higher than the peak of Delta in 2021, but the fertility rate is much less. The ICU utilization and the ventilated patient much less compared to the Delta variant. So we see a decoupling effect. Cases goes up, but in terms of admission, the severity of cases are less as compared to Delta variant. Next. So a decoupling effect, despite seeing an increase in the daily new cases and hospital admission, the vaccine shows effectiveness in protecting the vulnerable population from getting severe infection. So this is the main aim of the vaccine. It doesn't make us immune, that means a sterile immunity, which means that it will stop all infection. I mean, we still can be infected, but at least the severity is less. But this vaccine is not pan COVID-19, which means all variant comes in is effective. But so far, so good. Omicron, BA1, BA2 responds to the vaccine today. And more importantly, we do not have a vaccine that will have will keep the immunity plateau and high all the time. So we know there's actually a waning of antibody within 3 to 6 months. And now we are seeing a small numbers of admission to ICU and low case fatality rate, which means the vaccine works. So if the vaccine works in terms of to protecting ourselves and our family, which means less admission to the ward, less admission to the ICU, and the utilization of the ventilators, and less fatality as been documented. As of the epidemiology week 10, so we see this decoupling trend is expected to continue. And we are watching this closely, whether when the cases goes up, our fatality also go up. But now the cases has plateaued, and as well as our admission also has plateaued. And the Ministry of Health will continue to monitor the situation closely and increase preparedness in the field in preparation for the international border reopening. Why are we ready to open our international border? Now, when we started, there are 2 approaches. Number one is that we embrace prevention and control approach, whereby Sweden and UK initially they utilize and embrace the herd immunity approach. At that point of time, the idea is that more people get infected, then once they recover, they have a natural immunity. But unfortunately, the consequences of that is that those vulnerable population, when they get infected, they succumb to the illness. That's the reason why there's high fertility earlier in Sweden as well as in UK. UK probably they have more than 140,000 dead. And so we have to revert back to the prevention and control measures. And when we have the vaccination, so vaccination coverage already reached about 98% for adult, and in total for the population is about 79%. So this is you can see that the total population is about 78%. But more importantly, the booster dose is only about 47.2%. But for adults, the booster dose is about 65%. But those completed primary vaccine, about 97.5. To date, probably about 98%. Children, first dose only 34.4%. But adolescent, 12 to 17 years old, we already reached about 92%. So that gives us a good vaccination coverage. And and about 3.5 million people has been infected and recovered. And plus with this vaccination, so our immunity, acquired immunity is high. So which means that it is about time for us to open, but we still continue the public health and social measures. We still continue the national testing strategy. And if you are infected and we have antiviral now, that is a Paxlovid as well as Molnupiravir that we can treat to stop the progression to the advanced category 4 and 5. Next. So COVID-19 variant detected in our shore from 28 December 2021 to 3rd of March 2022. Namely, you can see the Omicron spike initially were detected in January and February 2022. But our first case was reported on the 2nd of December 2021. The earliest spike, you can see the gray bar is mainly Delta variant. So now the Delta variant has been replaced by Omicron. And Omicron, there's a BA1 and BA2. So BA1 is about 80% and 20% is BA2. But nonetheless, both are Omicron. And our strategy remains the same. So from 1st of December 2021 to 3rd of March 2022, a total of 548 travelers that arrived in Malaysia were confirmed to have Omicron infection. And more than 80% at that point of time, earlier in January and February, were due to travelers from Saudi Arabia. Next. And reopening Malaysia safely. This is the key, that we are not able to stay at home or to confine ourselves for a long period of time. We are not able to stay at home for 2 years. We need to balance health and economy. So we must continue to monitor the situation and learning from others. Reopening safely is the key, and we must learn from other countries, and we will benefit from their experiences as well as our own, and more importantly, not to repeat the same mistake. So despite the high vaccination coverage, we must continue to comply to all public health and social measures. This is the key, and because of the vaccination coverage is very high, and and plus the natural immunity from those who have been infected, so we think we are ready to open. But we still need to comply with the public health and social measures. We still need to put on a mask. We still need to practice physical distancing where possible, and keep a good personal hygiene, hand washing, etc. Practice trace and also make sure that in confined spaces we have a good ventilation, avoid crowded places, etc. So we believe that if we use the tools that we have, public health and social measures, national strategic testing, and plus vaccination coverage for booster dose for those vulnerable population, and the antiviral, we may able to control the situation much better and open up our borders safely. Next. So the 7 components in preparing Malaysia into endemic phase or reopening safely is to live with COVID-19. Number one, we need to look into our standard operating procedure, the SOP. We are going for one SOP with 9 recommendations. Number two, heightened alert system. Mainly, we have a warning system to look into the sequencing of the virus and whether there's outbreak or high density in the high density area and early detection. So we need to continue to monitor the situation. Then we have a national testing strategy. This is when to do the testing, how to do the testing, and etc. And we need to self-empower the public. That is a test, report, isolate, inform, and seek help. And the fifth is the digitalization, automated FTTIS, find, test, trace, isolate, and support. So now, within 2 years period, we started with a MySejahtera, very simple application. But now, after 2 years, you can see the MySejahtera is very complex and very helpful. And more tools been used in MySejahtera to monitor as well as to localize contact tracing, etc. And number 6 is economy. We need to open safely our international border, our interstate border, and etc. And more importantly, last but not least, is a public empowerment. The public must come in, the community must come in to be our ambassador to make sure that compliance to the SOP is important. We start in the family, so at least that compliance of putting on a mask, compliance of physical distancing in terms of hand washing and personal hygiene, avoid crowded places if possible, avoid confined spaces if possible, and this is some of the measures that you need to take, and we can break the chain of infection using public health measures, external protection and vaccination for internal protection. And the testing is actually to identify the cases and break the chain of infection. And last but not least, if you have been admitted to the hospital, we still have the tool, the last resort, to treat the patient to stop the progression to advanced stage. Next. Now, there are 7 components in the recovery phase. That is a transition towards reopening safely to endemicity. Number 1 is we still use the application, the barcode, so that we can track and trace if needed be. Then mandatory to put on a mask. 3, as far as we are concerned, we have to practice physical distancing. But we do know in some areas we are not able to in public transport and etc. But keep the mask on. And number 4 is the improve the ventilation. In confined spaces, and Ministry of Finance is giving some perks and incentive for those who can actually improve their premise as well as the place with a good ventilation system. And obviously the vaccination. So today we are encouraging the vulnerable population to come forward for their booster shot, as well as the children aged 5 to 11 to get their booster. But however, children below age of 5, we still do not have a vaccine for them, and we need to protect them using other measures. And number 6 is testing. That is actually followed under national testing strategy. Last but not least is to personal hygiene, to wash our hands, to make sure that we comply to cleanliness. Next. So with that, ladies and gentlemen, last but not least, I think in the leadership, we need to look into what skills do we have, how do we engage our skills with our team, and share our thoughts and also our goals with the team, bringing together the public and engaging with the public to explain issues and challenges and manage the public expectation, manage the team expectation, coming together as one. And I'm sure that we can solve and overcome the pandemic COVID-19 in time. And sometimes we need to go beyond the call of duty. This is important for us. If we can do so, I think this is where that coming together will make a big difference in our healthcare. Coming together will make the impossible possible, and we can perhaps, working as a team, we can achieve endless possibility to improve our leadership as well as to solve the public goals, that is actually to end the pandemic if possible, or to control the spread of COVID-19 in our country. With that, ladies and gentlemen, thank you very much for your attention, and I hope that this short presentation will give you a bird's eye view or eagle view of the scenario and the current situation that we are facing in our country. Sekian, wabillahi taufiq wa hidayah. Assalamualaikum warahmatullahi taala wabarakatuh.